Wellbeing Forum. Wellbeing Forum is an initiative by Jupiter Hospitals, Atladra, Vadodara. Now let's meet the founder of Wellbeing Forum, Dr. Tushar Patel, Senior Gynecologist and Obstetrician at Jupiter Hospitals. What is Wellbeing Forum? Wellbeing Forum is a group of people who works to elevate human beings. What are our intentions in Wellbeing Forum? Our intention is purely to give back to society in any form of nature. What will be the outcomes in Wellbeing Forum? The outcomes are such as we support in the area of healthcare services, medical policy, economic growth, physical, mental, and spiritual well-being, and uplifting the lifestyle of humans. Our mission is to provide the standard comprehensive healthcare services to human beings at their affordability, to support all the citizens to self-reliable economically for their healthcare expenses through medical policies at their affordability, an uplifting lifestyle of a human being for their healthy lifestyle, the physical, mental, and spiritual well-being of all our associates with their sustained economic growth. What do we do in Wellbeing Forum? We arrange a special guest lecture of approximately 45 minutes, which is called seminar, in which 5 minutes for the welcome speech, 30 minutes for speaker's lecture, and 10 minutes for answering your honorable questions. So now let's support an initiative by Jupiter Hospitals, which is Wellbeing Forum.
Good morning. This is Dr. Kavita Vadera. Today, as we are approaching September, which is PCOD Awareness Month, I thought why not talk about it. So now we'll burst few myths about polycystic ovarian disease. Polycystic ovarian disease is actually a disease where it is so common in India that almost 3 in 10 girls are now having PCOD. So, what is PCOD? PCOD is a metabolic endocrinological abnormality which is very common in young reproductive age. It is the most common cause of infertility in women, and it is also now prevalent about 3 to 22% in young reproductive age group. So, first, let's discuss what is PCOD. PCOD is an endocrinological disorder which usually manifests with amenorrhea, hirsutism, and obesity. Next. Why PCOD is so emerging these days? Why we never used to, हम कभी ये नहीं देखते थे कि हमारे सुनते थे कि हमारे ग्रैंड मदर्स में, नानीज है, दादीज है, मम्मी लोग में इतना PCOD तो नहीं होता था. So now why is it so common? So basically the causes of PCOD are most of them are unexplained, and basically why it has increased so much is because of the lifestyle changes. Because of the sedentary lifestyle, people do work from home, are usually sitting in front of laptops all day all night, and that's why all day, all night. So they are not very active, and they are not very physically active. And apart from that, there is lots and lots of increase in uh, eating of junk foods. So that's why there is a direct relation of PCOD with the lifestyle changes which this young generation is experiencing. So because of that, PCOD is more prevalent in these millennial generation than our ancestors. So PCOD, medically, if I explain you what is PCOD and how does it manifest. So PCOD, we can diagnose by having polycystic ovaries, which is seen in ultrasound finding. But apart from that, if a person has irregular menses, the menses come every 3 to 4 months, or they are irregular or very less periods, or in fact, when they get periods, they are very heavy after 3 to 4 months. So all these factors leads give signs of anovulation. Along with it, the third most common symptom of PCOD is hirsutism, where there is excessive male site hair growth, where you can see increase in hard dark facial hairs on the chest, on the abdomen. So all these are the symptoms. So what symptoms you see are mostly very commonly presented these days by adults and girls. And so how do we diagnose? Any two of these criteria should be present, either anovulation, which your gynecologist will decide once seeing your menstrual history, if they are irregular and if they are coming very less, or they are coming heavily after a period of anovulation of 3 to 4 months, or there is excess androgen or polycystic ovaries, which can be seen on ultrasound. So basically, every monthly हमारे ओवरीज में से एक ओवम निकलता है जिससे अंडा बनता है। बट अगर वैसे अंडा ना बने और उसके बदले छोटी 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 सिस्ट बन जाए जो ओवरी में पेरिफेरली अरेंज्ड हो, तो उसे बोला जाता है पॉलीसिस्टिक ओवेरियन डिसीज। So, what are the causes? As we discussed briefly, so it is not very common. It is not very clear as per to is it hereditary, or is it obesity, or is it the lifestyle. It is a multifactorial disorder where your lifestyle, your genetics, and even your families, it can be hereditary, and your obesity, which all with your lifestyle, all these changes combine to cause this metabolic syndrome, PCOD. Next. So now, why to worry? Why one should consult a gynecologist as they experience these symptoms? So not to delay the treatment exactly. So treatment हमें कब लेना चाहिए? जब हमारे periods irregular है, और या फिर हमारा weight बहुत ज़्यादा बढ़ रहा है, या फिर हमें pregnancy नहीं रह रही है after marriage and for trying for long, or we are even a risk because it has a risk factor of diabetes, heart disease, and hypertension in future. So one can consult a gynecologist, or one should consult a gynecologist as they experience these symptoms. So, as we discuss these symptoms, because what is the pathophysiology? क्यों होता है PCOD? उसमें most common is insulin resistance. Insulin resistance is the root cause of PCOD. So, when you have insulin resistance, your ovulation, हमारे जो अंडे हैं वो नहीं बनते हैं, और उसके कारण हमें पीरियड्स नहीं आते हैं, हमें इनफर्टिलिटी हो सकती है, हमें आगे जाके डायबिटीज़ हो सकता है, हमें उसके कारण मेल पैटर्न हेयर ग्रोथ हिर्सुटिज्म हो सकता है, हमें पिंपल्स आ सकते हैं फेस पे, और हमारे पीरियड्स इरेगुलर हो सकते हैं। So all these lead to PCOD. As you can see, the male facial hair growth, there can be acne, or even alopecia is common. This is acanthosis nigrans. Because of insulin resistance, there is thick pigmented skin over the nape of the neck and inner thighs. So this is not male jamna on your neck, but it is actually a sign of insulin resistance. So you should go and get yourself checked hormonally when you see these insulin resistance changes. Okay. Next. These insulin resistance, which causes annulation and PCOD in the initially, but long-term risk of PCOD is diabetes, heart disease, hypertension, cholesterol बढ़ना, endometrial cancer, breast cancer, and even ovarian failure after surgery. So all these are long-term risk factors of PCOD, which can again lead to uh, risk in life, and so one should check when they have PCOD. And it is not very difficult to diagnose with so many ultrasound is so uh, now affordable and accessible. So as you can see in the picture, the cyst in the ovaries are peripherally arranged, and this type of picture is seen on your ultrasound, or even we can see laparoscopically PCOD if required, if laparoscopy is done. So it is very easy to diagnose PCOD through ultrasound, through some blood test, and of course through some history of patients. So what, how do you treat it? जब हमें पता है कि PCOD आपको हो चुका है, तो how one goes about treating it? So the most common uh, and the first line of medication is lifestyle medication, lifestyle modification. So first of all, one should increase the amount of exercise or the amount of physical activity which one does. जो आप physical activity करते हैं day to day में, should be at least half an hour. Studies say that even if you reduce 5% of your weight, then your hormonal cycles can be regular, your uh, periods can come back cyclic, or you can also have your fertility just by reducing your weight and having a healthy lifestyle. Second is have a healthy diet. So today eating junk foods, dabeli, pasta, pizza, pani puri, all these highly leads to increase in insulin resistance, and this high carbohydrate diet one should avoid. Try to restrain it to few days in a month and not have it daily. All this significantly helps in reducing your weight, which ultimately leads to increase insulin sensitivity, and it boosts your hormones, and you can easily cure PCOD by just changing your lifestyle. Be active at least half an hour to 1 hour. You have to run, or you can just do some yoga or some cardio, go hit the gym. So all these will help you reduce at least 5% of your body weight, and that is the treatment of PCOD, which one should opt for before going for any medication. And second, I would like to say that once you are married and you want to conceive, so हम बहुत बार सुनते हैं कि PCOD है तो बच्चा नहीं रहेगा, infertility है, जाओ जाके डॉक्टर को दिखाओ. So ऐसा बिल्कुल नहीं है. Every PCOD patient can conceive naturally. They don't require treatment. Everyone doesn't require treatment. So once you got married, you first give a shot to naturally conceive, and maybe for 5 years, for like 6 months to 1 year. And once you cannot conceive naturally, you can go to your gynecologist, and you can go to a gynecologist and consult. So there are modalities. You don't have to straight away jump on IVF for PCOD. There you can conceive naturally. If your eggs are not forming, then you can go for ovulation induction, जिससे अंडे बनते हैं, वो दवाइयाँ दी जाती है जिससे you can still conceive naturally. And then the third is ovulation with induction with IUI, जिसमें जो शुक्राणु है वो अंदर डाले जाते हैं एक बार अंडे बन जाए तो. And fourth, if it is high grade PCOD and you're not conceiving by all this, then one can uh, go for IVF. But let the gynecologist evaluate, and it's a myth that PCOD hai, so you cannot conceive naturally. So one should definitely try, and with at least 5% of your weight loss, you can you can make your hormones run on normally, and you can conceive normally. So obesity we can treat by diet and exercise, and infertility first you have to try naturally, and otherwise there are few very good drugs for ovulation induction like clomiphene that will help make your eggs and eventually make you fertile. Some women have long periods of amenorrhea for 3 to 4 months, and then they have heavy bleeding. For that, we suggest oral contraceptives. One, your lifestyle modification has been done. Once you have tried to do weight loss and still your uterine bleeding or irregular menses are persistent, then we can definitely add some contraceptive pills. And these days, the pills are so good that they don't cause you weight loss, they don't cause you acne. In fact, they help you decreasing all these. So not to worry that OC pills जो है they are उससे मेरा weight बढ़ जाएगा या उससे मुझे बहुत सारे चेहरे पे pimples आ जाएंगे. So in these modern era, there are very beautiful drugs which are very sensitive to what they are intended to, and they cause very less side effects, so one should feel free to go to gynec and start those pills. For hair growth, one these pills can help, and otherwise you can then have your hair removal or even laser treatment can help it. PCOD can also cause recurrent abortions in 4 to 10% of the patients, where once you conceive also, so later you need to be progesterone covered, so that the chances of recurrent pregnancy losses, early pregnancy losses, which are stated to have in PCOD, that can be reduced. So if you are conceiving normally and you are a case of PCOD, you should immediately go to doctor once you conceive or once your UPT test is positive, so that they can cover you for recurrent pregnancy losses and help you give a healthy baby. Uh, next. So, as we have already discussed, diet and exercise are the mainstay of treatment. So, what diet should you take? I'm not saying that you should just eat ghar ka khana, or you just cannot you cut down your sugar, but at least you can cut it to half, or maybe the amount of roti and rice you take, you can cut it to half, and you can increase protein in your diet by increasing egg, dal, all the sprouts and all the legumes in your diet. So all these healthy dietary habits you can inculcate in your lifestyle, and maybe you can then have your weight loss, and then see that a return of ovulatory cycles are almost 30% in the women who are not on any other medication, but just by diet and exercise they resume their ovulatory cycles, and ultimately they have their regular menses, they are fertile, and they don't have long term, what we know that because of insulin resistance there are long term uh, side effects of PCOD, which include diabetes, hypertension, and increased cholesterol. So all these can be even guarded by just your lifestyle modifications of changing in diet and adding physical activity to your routine lifestyle, be it just 30 minutes, but you should go out, run, or you should just do some surya namaskar or some yoga at your home, or you just can do skipping, jogging, whatever is comfortable for you, but make sure that half an hour you devote to yourself and you do exercise every day. So to conclude, God is not everywhere, so he created women. And as September is a PCOS awareness month, so I thought let's just make you aware कि PCOD होता क्यों है. आई होप इट इज़ क्लियर कि अगर आपको इरेगुलर मेंसेस है, अगर आपको शादी के बाद 1 साल ट्राई करने के बाद भी पीरियड्स नहीं रह रहे हैं, या फिर अगर आपको मेल पैटर्न हेयर ग्रोथ है, तो डोंट वेट, जस्ट गो मीट योर गायनेकोलॉजिस्ट. यू डोंट हैव टू स्ट्रेट अवे गो टू स्टार्ट पिल्स एंड टेक ऑल दोज मेडिसिन, बट एटलीस्ट यू कैन कंसल्ट and know what it is, get your diagnosis right, and then start your treatment. Thank you.